Hey everyone, welcome back to Parently. Dr. Boyd here. Today we're talking about a very important topic for most women late in pregnancy, and this is your cervical exam. And the reason this is important for both a healthcare provider and you as a patient is because it's information, it's objective information that you as a patient and the healthcare provider can use together to determine if you are a candidate for a vaginal delivery, if you're a candidate for going into labor early or later. Those are all topics that are helpful in knowing your cervical exam. So I'm going to be very detailed today explaining what a cervical exam is and how that relates to labor and delivery. Now, a cervical exam, what does this mean and how is it done? The cervical exam is going to start somewhere around your 36th to 38th week, depending on if you're a first-time mom or if you've had a vaginal delivery in the past. Now, we're just going to use you as a patient, as a woman, and look at two different scenarios. We're going to look at the first-time mom, she's called a primip or a nullip, and we're going to look at a mom that's had a baby in the past, she is called a multip. So we're going to address the nullip or the primip first, and we're going to examine you as a patient, and we're going to explain how we do that. So you're going to come into the office around 38 weeks. We're going to put you in a laying down position on the exam table. We're going to put your feet in stirrups, maybe, or we're going to pull your feet up by your bottom in a frog leg position. The healthcare provider at that point will take one finger or two fingers and place them in your vagina, and we're going to assess both the opening of your cervix and the thinning of your cervix. The opening of your cervix is called dilation. Now, you dilate your cervix from 1 centimeter to 10 centimeters. Now, 2.5 centimeters equal 1 inch. So full dilation is 10 centimeters. So it's about 4 inches. So that's about this big. That's the size of a newborn baby's head. That's approximately 10 centimeters. That's fully dilated. Obviously, on the other end of the spectrum, when you're 1 or 2 centimeters dilated, you're dilated about this much. Again, dilatation or dilation, synonymous terms, that simply means your cervix is open. The next thing that we assess as a healthcare provider is your effacement. Very, very confusing term for a lot of patients. The normal length of your cervix is about 4.5 centimeters, 4.5 to 5 centimeters. So it's about 2 inches in length. As you start the process of getting prepared for vaginal delivery, your cervix will start to thin out. That means the length of your cervix will start to shorten like this. So shortening of your cervix, thinning of your cervix, effacement are all synonymous terms, and you will hear all of those in a healthcare provider setting. The third issue that we are attempting to identify when we examine your cervix is the location of your baby's head. We want your baby's head to be in the head down position. That's called vertex. And we oftentimes can tell because we can feel the baby's head in your pelvis if your baby is in the vertex presentation. If we can't tell the position of the baby, or we're feeling a butt or a leg, those are issues that we determine oftentimes by ultrasound. So if we're not sure of the position of the baby, we will take you in the other room and do an ultrasound or sonogram to determine the position of the baby. Very important as we're doing this exam that the healthcare provider is communicating with you what these various items mean. Cervical dilation or dilatation, effacement, thinning or shortening, and position of the baby. Those will help prepare you of whether labor will occur naturally, vaginally, or whether you will be a candidate for a cesarean section. Now, important also to understand, there's not a lot of correlation between cervical dilation, effacement, and labor. This is very, very confusing to patients because they say, "Doctor, you said I was 4 centimeters, 50% thinned out or 50% effaced. Surely that means I'm going to go into labor today or tomorrow or the next day." No, that's not true. Women can stay advancedly dilated for days and days, weeks and weeks, even months and months. Now, in saying that, as your cervix is changing, going from 1 centimeter to 2 centimeters to 5 centimeters, obviously there's progression that most women follow. So if we're now 40 weeks gestation and you were 2 centimeters last week and now you're 5 to 6 centimeters, typically that means you will go into labor soon. Now, again, what is soon? Is that today, tomorrow, the next day? If your healthcare provider tells you that, it's a pure guess. Sometimes patients do, sometimes they don't. It is an interesting statistic that 90% of patients go into labor within 10 days of their due date. That means 10 days on this side, 10 days on this side. So if you get to your due date and you haven't delivered, that typically doesn't mean that something bad is going on. It simply means that you're not there. Now, the other patient I wanted to address is the patient that's had babies before, and we call her a multip. Now, multiparous patients typically, if they've delivered vaginally in the past, have a faster labor than they had before. Faster and usually easier than they had before. So I'm going to give an example of a multip that is different from a primate. So oftentimes a multip's baby's head, that position when we examine the cervix, typically is higher in the pelvis than a baby that is in a first-time mom. So again, remember we talked about the nullip or the primate, first-time mom. Those babies oftentimes get into your pelvis as a woman earlier in pregnancy. And when you deliver those babies, oftentimes they have much more of a cone head because they've been in your pelvis much longer. In a multip, the baby's head stays higher until later in labor. Therefore, they don't spend as much time in the pelvis. So the long cone head that you see in the nulliparous baby, you typically don't see in the multiparous baby. These are some items that are very helpful for patients to understand the dynamics of labor. Now, we'll talk about labor on a separate video, but these are very important topics to understand for you as a woman later in pregnancy. Have a great day.